Now, what's the state of play in the fortified foods sector, and how can the global development community really scale up efforts here?
Well, we have heard that perhaps about 80 countries have in place fortification policies. Perhaps that's not enough, because we certainly have, probably at least half of the countries in the world, if not more, that would need a boost in the intake of vitamins and minerals. But also what we've heard is that the quality of fortification programs has been variable, and not always the vulnerable groups, those for which basically these programs have been designed, are reached. Either because the food system is not penetrating and not reaching them, or because of cost reasons, or also because of the actual quality of the implementation of the programs, the choice of the vehicle, the nature of the technology. So there's a lot to do to actually achieve our goals.
And to mitigate some of these obstacles, or overcome some of these obstacles, who are you talking to in the sector? Is it private sector engagement? Is it looking at new partnerships? Is it a problem of funding?
The most important thing is to understand a bit better what's happening. So I think we are realizing that there is a knowledge gap that has to be filled. At country level, we need to know more, for example, about what is an effective program, who is really reached by that program. And so that data gap has to be filled. I think that's really a priority. From the WHO point of view, we have to work with the regulators and the policymakers to make sure that the programs are designed according to the WHO guidelines, which are informed by the evidence. And giving governments the certainty that what they're doing is solid and based on evidence and not actually influenced by any vested interest, I think that's the first thing to do. So the reliability that WHO can provide is an important starting point for most governments.
And here this week I've heard a lot that the last mile is always the hardest mile, and particularly on hidden hunger issues. How do you reach that population that doesn't necessarily have access to fortified foods or condiments?
There's been a dialogue on this just today, and there's been a really serious consideration about the combination of different strategies. But we also need to see it dynamically. I mean, the food system is changing rapidly, and we need to anticipate those changes. The key considerations are what people eat and what people can afford to eat. So the equity issues and the cost issues of food is really crucial.
And in terms of policy coherence at the WHO, many of your colleagues would be calling for a diet in reduced salt. How do you make sure that levels of iodine in salt are well regulated and used as part of a balanced diet? What would your advice there be to some of the development implementers in the field that are carrying out such work?
That's a very important point, because we need to look at the diet comprehensively. So we're not just looking at the sector of health of the people. We're seeing an epidemic of non-communicable diseases affecting more and more low-income countries. In fact, the low-income countries are affected more because they cannot afford the increase in the cost and the loss of productivity of these diseases. So we want to see a healthy diet. And the efforts to improve the food system and improve the availability of healthy foods are not in conflict with the effort to fortify. You mentioned salt. I mean, we have actually developed some guidance on how to make compatible a sodium reduction strategy with an iodine fortification strategy. I mean, you simply need to adjust the fortification levels. This has been done in Finland, in Switzerland, very successfully. Similarly, we are going to face a discussion around the fat and around the saturated fat. Now, we are fortifying palm oil, and that is a very important vehicle for vitamin A, but at the same time, palm oil is rich in saturated fat. So the increase in consumption of palm oil due to its low cost may be a challenge for countries who have a risk of cardiovascular disease. So that will bring to an adjustment in perhaps the mix of oils which are used in the population. But I don't think fortification is going to be affected. We can fortify palm oil, we can also fortify other types of fats.